Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. My name is Wanu Aisyah Imani binti Warazman, and today our group will be presenting to you about Gerd. So, what is Gerd? Gerd stands for gastroesophageal reflux disease. This is the medical term for chronic acid reflux in your esophagus. Acid reflux is considered chronic when you have had it at least twice a week for several weeks. Temporary conditions can cause temporary acid reflux, but Gerd is a constant mechanical problem. It means that the mechanisms that are supposed to keep acid out of your esophagus aren't working right. So, how common are acid reflux and Gerd? First, it is occasional, uncomplicated gastroesophageal reflux (GER) and gastroesophageal reflux disease (GERD) are both common. Gerd is estimated to affect about 20% of adults and 10% of children in the US. Next, we are going to talk about the symptoms of acid reflux and Gerd. So, what are the symptoms of acid reflux and Gerd? The symptoms of acid reflux and Gerd may include: the first one is backwash. You might notice acid, food or liquids backwashing from your stomach into your throat after eating. This is also called regurgitation. You might notice the sour taste of the acid. The second one is the burning feeling. Acid literally burns the tissues in your esophagus. If it feels like it's in your chest, it's called heartburn. If it feels closer to your stomach, you might call it acid indigestion. And the third one is non-cardiac chest pain. Some people feel pain in their esophagus that doesn't feel like burning. Esophagus pain triggers the same nerves as heart-related pain does, so it might feel like that. Next one is nausea. Acid overflow or backwash may make you feel queasy or make you lose your appetite. Although you may have eaten a while ago, it may feel like there's still more food to digest. Next, sore throat. If acid rises into your throat, it can make it sore. You might feel like there's a lump in your throat or like it's hard to swallow. Reflux into your throat often happens at night. And the last one is asthma symptoms. Gerd can trigger asthma-like symptoms like chronic coughing, wheezing, and shortness of breath. If acid particles get into your airways, it can make them contract. Moving on to the next slide, we are going to talk about Gerd diagnosis. Your healthcare provider might be able to diagnose Gerd based on the history of your signs and symptoms and physical examination. To confirm a diagnosis of Gerd or to check for complications, your doctor might recommend the first one is upper endoscopy. Your doctor will insert a thin, flexible tube equipped with a light and camera, which is called endoscope, down the throat. The endoscope helps the provider see inside your esophagus and stomach. Test results may not show problems when reflux is present, but an endoscopy may detect inflammation of the esophagus, or called esophagitis, or other complications. An endoscopy can also be used to collect a sample of tissue, which is called biopsy, to be tested for complications such as Barrett esophagus. In some instances, if a narrowing is seen in the esophagus, it can be stretched or dilated during this procedure. This is done to improve trouble swallowing, which is called dysphagia. Second one is ambulatory acid pH probe test. A monitor is placed in your esophagus to identify when and for how long stomach acid regurgitates there. The monitor connects to a small computer that you wear around your waist or with a strap over your shoulder. The monitor might be a thin, flexible tube catheter that's threaded through your nose into your esophagus, or it might be a clip that's placed in your esophagus during an endoscopy. The clip passes into your stool after about 2 days. Next, X-ray of the upper digestive system. X-rays are taken after you drink a chalky liquid that coats and fills the inside lining of your digestive tract. The coating allows your doctor to see a silhouette of your esophagus and stomach. This is particularly useful for people who are having trouble swallowing. You may also be asked to swallow a barium pill that can help diagnose a narrowing of the esophagus that may interfere with swallowing. And the last one is esophageal manometry. This test measures the rhythmic muscle contractions in the esophagus when you swallow. Esophageal manometry also measures the coordination and force exerted by the muscles of your esophagus. This is typically done in people who have trouble swallowing.
Risk and factor of GERD. GERD risk factors include certain health conditions, medication, and lifestyle factors such as pregnancy, obesity, and smoking. First is pregnancy. GERD is a common medical condition during pregnancy. A person may develop GERD during pregnancy due to hormonal changes that affect the stomach muscle, abdominal pressure from the growing uterus, weight gain during pregnancy, nausea, and vomiting. Second is hiatal hernia. A hiatal hernia is a condition in which the upper part of a person's stomach has moved up into their chest. Their stomach then pushes against the lower opening of their esophagus, allowing stomach acid to travel upward. Third is obesity. Having overweight or obesity can increase the frequency of reflux symptoms. Overweight or obesity can also increase a person's risk of developing GERD. Next is gastroparesis. Gastroparesis is when a person's stomach takes a long time to empty. People with gastroparesis have a stomach muscle that work inefficiently or not at all. Delayed stomach emptying can increase the risk of GERD. In lifestyle factors, smoking more than 20 cigarettes a day increase a person's risk of developing GERD. For female smokers, their risk increased by 37% and by 53% for male smokers. Stopping smoking can reduce GERD symptoms and improve a person's quality of life. Last, dietary risk factors for GERD may include consuming fatty, fried, sour, or spicy food, stress, eating meals at irregular times, and asthma. Risk.
Similar to other diseases, it can also cause some serious complications if left untreated, such as esophagitis, esophageal stricture, and also Barrett's esophagus. Esophagitis is an inflammation of the esophagus. It can also lead to gastrointestinal bleeding, while esophageal stricture is the repeated irritation that can cause scarring in the esophagus, making it narrower. This can cause difficulty swallowing, whether it is your saliva or your food. Lastly, Barrett's esophagus. The cells lining the esophagus can change into cells similar to the lining of the intestine. In other words, the cells that are laid to cover the exposed area are no longer squamous in origin. These precancerous cells initiate the healing process and can lead to esophageal cancer.
Next, how to prevent GERD. First, follow a low-carb diet. Research shows that eating a high-carb diet can worsen acid reflux and reducing your carb intake helps reduce the symptom of GERD. Some researchers suspect that undigested carbs may cause bacterial overgrowth and increase pressure inside the abdomen, which could contribute to acid reflux. Having too many undigested carbs in your digestive system can often cause not only gas and bloating but also burping. Second, maintain a healthy weight. However, if you have excess belly fat, the pressure in your abdomen may become so high that the lower esophagus sphincter get pushed outward away from the support of the diaphragm. This condition, known as hiatal hernia, is considered the leading cause of GERD. Furthermore, research showed that having excess belly fat may be associated with a higher chance of acid reflux and GERD. Obesity in general is associated with a greater chance of getting GERD due to greater pressure within the abdominal cavity. Third, don't drink too much citrus juice. Many types of citrus juice, including orange juice and grapefruit juice, are considered common trigger for heartburn. These ingredients are highly acidic and contain compounds like ascorbic acid, which could cause indigestion. If you consume them in large amounts, it may irritate the lining of your esophagus. 4. Have small frequent meals. Don't chow down on 3 large square a day. Instead, eat 5 smaller meals that you spread throughout the day, and avoid a large meal at dinner time. This keeps your stomach from stretching and pushing foods and acid outward, which makes GERD symptoms like acid reflux worse. 5. Don't eat before bedtime. Try not to snack or dine at least 2 to 3 hours before you go to sleep. When you lie down, gravity pulls whatever in your stomach towards your esophagus. Esophagus is the tube that connects your throat and stomach. By eating earlier, there is less food in there to come back up and bring on GERD symptom. 6. Wear loose clothing. Don't wear belts, slenderizing undergarments, or clothes that are tight-fitting around the waist. This item can squeeze the stomach and force food up against the esophagus sphincter and cause reflux and heartburn. 7. Sleep on the left side. Due to gravity, the shape of the stomach and the angle of the connection between it and the esophagus, sleeping on your left side can greatly reduce reflux. That's all from me.
So, there are 3 ways to treat GERD, which is through medication, endoscopic therapy, and surgery. For the first one, through medications, antacids are best for intermittent and relative infrequent symptoms of reflux. They enter the stomach quickly and increase the acid production. For the second one, histamine blockers or H2 are drugs that lower acid secretion. For the third one, proton pump inhibitors, which is drugs that block the 3 major pathways for acid production, and it is more effectively than H2 blockers. For the fourth one, prokinetic agents, which is drugs that enhance the activity of the smooth muscle of gastrointestinal tract, and it is less effective than PPIs. For the second way, which is through endoscopic therapy, TIF or transoral incisionless fundoplication is using a special TIF device to create a passageway for a flexible tube-like imaging instrument called endoscope. The procedure allows the physician to use preloaded tweezers or fasteners to repair or recreate a valve that serves a natural barrier to reflux. For the third way, which is surgery, the first one is fundoplication, where the surgeon wraps the top of the stomach around the lower esophageal sphincter to tighten the muscle and prevent reflux. Fundoplication is usually done with a minimally invasive laparoscopic procedure. And the second one is LINX device, which is a ring of magnetic beads is wrapped around the stomach, around the junction of the stomach and esophagus. The magnetic attractions between the beads is strong enough to keep the junction close to refluxing acid, but weak enough to allow food to pass through it.